Hi, do you have episodes where you feel pain in your chest, or maybe you have a family history where someone in your family also had a heart problem, or you have high blood pressure, or maybe you're a diabetic? Then today it's the right time to check whether you're at risk for a heart attack, and I'm going to tell you some warning signs and tests that you can do very easily through a single blood sample. I'm Dr. Bhargav Rao, the Chief Pathologist at Pathofast Lab in Pune, and we perform blood tests and lab tests for a variety of diseases, including heart problems. Now that you're watching this video, we first need to be sure that you haven't already had a recent heart attack without even realizing it. This can have happened and your heart may be already under a lot of pressure. The simple way to check for this is by doing one of all these blood tests, which include the troponin I test, the CKMB test. If either of these tests shows a very high value, it could be a sign that you've recently already had something like a heart attack, or your heart is not functioning properly and you should consult your cardiologist immediately. The next thing that we need to check for is whether there is a lot of inflammation and swelling inside your blood and your body. This happens when there are elevated levels of metabolites like homocysteine in your blood, which can damage the vessels and the arteries that supply the oxygen to your heart. If there's swelling inside these arteries, it causes blockage and plaques to develop. You can check for this with simple blood tests like the ones I've listed. Homocysteine is a test which is not very commonly tested. A high homocysteine level definitely puts you at risk for heart problems. Together with this, the CRP level is also very important to check how much inflammation is there inside your body. The next thing to check for are your cholesterol levels. While you may already be aware of it, high cholesterol causes blockages in your heart and this can lead to a heart attack. The most important tests to be checked are the LDL cholesterol, also called the bad cholesterol, which is called the LDL or low density lipoprotein cholesterol. Together with this, you should also check your total cholesterol and your triglyceride levels. If your LDL cholesterol is high, or if either of the other two are high, you are definitely at an increased risk of having a future heart attack. You should consider changing your lifestyle to improve this. High blood sugar levels damage the vessels that supply the oxygen to your heart. They damage your arteries and this can cause a heart attack. Simple ways to check for blood sugar are your fasting blood sugar test, which should be less than 100, as well as your HbA1c, which is the 3-month average of your sugar, which should be between 5 to 6.4. These are broad guidelines. You should check this at least once in 3 to 6 months and make sure that you're in the normal range.